So wonderful case study presentation, ma'am. Wonderful. I mean, I can feel the happiness of the child. So beautiful. So beautiful. So,
Thank you. Yeah.
so dear coaches, ma'am is here to address all the questions if you have any. So, anyone who have query is all welcome.
Excellent. You know, I can see the detailed, case history is the key. You know, how many things like one CBI you have investigated and found out. But, it's really great. We have to have that, mindset and the patience and the, as sir tells all the time, honest curiosity, you know. the- as I'm talking, I'm having goosebumps. I mean, it's so, what a, like, you have given a great life to that girl. This is what is the satisfaction. Excellent. So many things we have to uh, dig out, and from the family also. Even though the mother was good, on the first meet itself everything looked okay, but still you have probed. No, I don't know whether I would have done that, but every day is like addressing a new case in this girl's thing. So every day you have found out something. So really that it shows your involvement and dedication. Hats off to you. Superb.
Thank you so much, Magita. Yes, this case really helped me professionally to gain more confidence. As I also mentioned in the during the case presentation, that that was the first case of me handling a type one, and I felt like I won't be able to do it. But Sir insisted that yes, you can take it. Actually, it was like open for either me or Danya. So I said, okay, let me try. So Danya then handled the second case of type. That was another beautiful journey with her.
That
And
infertility, no? I mean, sorry, PCOS or something like
no, no,
one
no, no, no.
tribal girl. No,
Tribal girl. Yeah, she didn't
tribal
attain her
girl.
puberty.
Puberty. Yeah, yeah.
Yeah.
Okay.
So that case probably we'll discuss that case the next presentation. But coming back to this case, yes, it was like it's like when you're very hungry and someone is going to feed you, you will try to eat the maximum, right? So that's how it was for me that time.
Oh,
So was with holistic training program, and suddenly this case popped up, and we were all locked in. We had this COVID lockdown, and so everything has to be done on a virtual basis, and lot of readings has to be
yeah.
done, and it was interesting. It was really interesting
Already type 1 itself is the biggest challenge
challenge.
to make the children, follow our dietary guidelines. And
No,
my
I must
God,
really give the credit to that family. A more credit to them actually, because they were like very, very supportive, cooperative, and you know, right? 13-year-old is not easy to handle, but that girl was
I
very
know
innocent. Though the age was 13, she was behaving like lesser than that, and probably that really helped me a lot.
there was
So
financial challenge also, to make them buy vegetables, dal and all. For a normal middle income group only, they don't, even though they have money, they don't like to spend on all these, they don't know the importance. And as this insulin, that needle, I mean, it's very much important to address that part also. Like even a blunt needle can do harm. I mean, it will not inject the insulin properly, the positioning, so many things. So you have addressed all the areas. That's why you could see the success.
I didn't mention during that presentation. Actually, I was doing the rotation of site as well, because that girl was being injected on the thighs, and the thighs have
Yeah.
become really numb.
Okay.
And so the point here is, I have to keep rotating, and I also wanted to make sure. Sometimes she was injecting directly in the this thing close to the navel also. So if she's
Okay.
going to do that, then there shouldn't be much of a time gap between the insulin and the meal taken. So
Yeah.
those
Okay.
things have, I mean, they never were aware about all these things. So it was like completely from the scratch we were working as if it's like, just now they got diagnosed with type 1 diabetes and how we have to do it. That's what previously I was under the impression they might be knowing all these things, but it wasn't the case. So what we understood after presenting the case was like there was a lot of scope for a dietitian, because doctors doesn't have time to educate the uh, client more
Yeah.
than the what say the prescription of medicine. I felt like education was the key. Sir always used to say ignorance is always costly, very expensive. So education is not. So as a dietitian, as coaches, we have a lot of things to do and a lot of scope for us to really create an impact in one's life.
Great. Congratulations.
Thank you once again. So, Ashwita, I didn't convince anyone. The case actually came to me through a doctor's reference, knowing about our work. So it was a case where we did it as a, like a teaching. We didn't charge anything. We just took that case as a challenge and worked on it. So, any questions? I just recorded the session. Thought of like might be some new questions, new discussions may happen.
Hi,
Thanks, Ashwita.
Rinki.
Yeah, hi Jyoti.
I'm in the middle of
Yeah.
traffic. Sorry for the disturbance if it is there.
So,
Congratulations again. But this is always a memorable case to remember ever. The first type 1 diabetes reversal. So my question is, after 3 years, it's been 3 years, right?
yes, yes,
So
yeah.
was there any follow-up done after that?
So the case I was able to follow up for 1 year actually. The case I presented was for only 3 months, but after that I was continuing with that family till 1 year. After that I didn't have any connection. There was a problem with the mother's phone. After that I couldn't connect, and father was always busy. Even then also I hardly spoke to him. Only the mother was the one point contact for me. So 1 year, I actually made the follow up. That girl. I did the follow up till she was gaining like 43 kg. It was a steady increase in her weight, and the sugars were dropping, but still she was on the same insulin level. The insulin level they didn't reduce it. So that was the case. After that, after few more months, then I got to know that the girl's grandmother passed away because of diabetes only. And now the girl is doing really well. I used to check their WhatsApp status. Still, the father is no in my contact. But as such, till 1 year, it was really going good.
Okay, wonderful. Thank you. So one year follow-up is itself is a great follow-up, but if we have data on this now, if we can get it by any chance, it would be so good. No, we can make it a longitudinal study.
Definitely,
Try
definitely.
to try to
I'm
bring
just
it,
trying.
Revathi. Set your intention, do whatever, you know, try to bring it now.
Definitely, yes. Yes, yes.
So my new thought to write a new paper.
Sure. No, I'm actually working on it. Just started. Even when I was listening, I was just trying to text both the parents. I mean, the mother and the father. Father responded luckily today. Uh, Before I never got any response. Today I got a response to him. Probably, yeah, I will try to
See, that's a
connect
positive
with him.
sign.
Yeah. So if possible, I can even
Yeah,
reconnect, and I can again
yeah.
restart with that girl if it's possible.
Yeah,
Yeah.
probably one blood test now could also bring us a
Yes.
picture of what is it after 3 years. Then we can definitely build up a great paper.
No, that girl has grown up really well. I was just looking at the DP, the display picture of the father. That girl has really grown well, and she's really looking pretty now. No underweight. So that itself shows that our sugars are like pretty well under control. Even though it's been like 3 years, I connected with them. So I'm able to see that the girl is somehow trying to make it up, but I really wanted to reconnect and I wanted to check what this can be done.
Oh, wonderful, wonderful. I'll wait for your data sheet very soon.
Sure, sure,
Bring it up,
definitely.
Renji.
Thanks, Jyoti. Yeah. So, coaches, expecting
Congratulations
all
once
your
again.
thank you. Expecting all your blessings and wishes so that I connect with the parents. We will have another, a very good case study, more credibility for our work. Right. So, any questions? Do we have any questions? No questions? Okay. So,
Akka, it's
thank
not
you so
regarding.
much. Yes,
Sorry, this
Vijay.
is Vijay.
Yes,
It's not
yes.
regarding the case. How you are feeling after 3 years, and then you are seeing the same case?
It's very fresh for me now. I'm just trying to recollect even whatever I spoke. I was just recollecting. Okay, this was the information I spoke. Eventually, see that case was very. Still, it is very close to my heart because I was completely present when I was doing that case. Off late now, that kind of a connect is not happening, but still, this case really helped me to um, stay in my present moment. Every call I still remember. Now down the line 3 years, it's very, I mean, definitely it is bringing a smile on my face. The only thing is a small part which is making me a bit low is that I couldn't stay connected with the family. I lost that connection, maybe for a reason, maybe something to learn. So uh, as I said, there's a response from our father, so I'll try to reconnect and get back again. If I'm able to do some more study with this girl, helping her again, I can do it.
Yeah.
The
Because after
universe
seeing
will
long
connect the
time,
dots.
Hoping.
yeah. After
With this
seeing
note,
our things,
yeah, continue with you. I have one.
no, no, no. After seeing our things, after I know it will be great blessings.
But probably, Revati, you can throw more light to all the coaches and students. See, if it is type 2 diabetes, everybody knows what is reversal. But when it comes to type 1 diabetes, when we say it is reversal, what is that they have to look into it? Can you throw more light on this?
Okay. So, see, first of all, diabetes itself, what we look into is the blood sugars alone. We think that only when the blood sugars drops, then there is a light in the case, right? But in this case itself, this single case itself, what I can share you is, see, whatever the complaint with which the client comes to you, whether it is type 1 or type 2, whatever, they have, it is not only the excess blood sugar they come up with, but they have other issues as well. Like in this case, this girl was like deprived of sleep. This girl didn't have that satiety, feeling of fullness after eating, even though after eating 8, 9 idlis, still she never had that feeling of fullness. Imagine just we are eating and we don't even have that feeling of fullness. That is like a curse, right? So that was another thing. So what I'm trying to say here is, whatever the complaints they come, try to address that. It is not just the blood sugar that we say it as a reversal. Even the symptoms that is associated with, even that we are able to get out of it. In this case, it was like for so many years. I don't know when she started experiencing this kind of not being able to sense that fullness, that I couldn't get that data at that time. But I don't know how many years she was going through this, eating a lot of food but not feeling full. So at least if we are able to get the client out of it, that is a success. And so the complaints as such, that itself can be definitely taken it as reversal. But probably in clinical, when we presented this in the conference, people were like, how can you use the term reversal? Probably you can use that remission. Type 1 cannot be reversed. For me, I probably, yes, I used a terminology in a wrong place. I said like type 1 reversal. Probably I should have said like the symptoms of type 1 reversal. I mean, the symptom reversal in a type 1 case, something like that. So, as such, it is not just the blood work what we are trying to reverse, but still, since the world needs proof, we are taking the support from the blood diagnosis from the reports. But as such, the symptoms also plays a very, very vital role. Sometimes symptoms cannot be diagnosed using any kind of methods, machines, but still the client says like, you know what, I'm suffering with it. Are there any machine to say that this person is sleep deprived? Even though the smartwatch can say like you slept really well, but if the person doesn't feel that, no, I didn't sleep well, it's just the machine is showing me that I slept well. So how are we going to go about it? So it's not always about the machine reading. It is not always about the diagnosis on the paper, but it is something beyond. So even we had the same discussion, when we had Jyoti with us for this, how to convert the cases into paper when we don't have much of quantity thing, but more of quality thing. Yeah, of course, yes. People say like the blood reports are normal, but the symptoms are still there. Then doctor says simply, yeah, it could be because of stress. We don't know idiopathic. Yeah, we can use the same weapon, I can say, for our benefit. That way also we can do. So coming back to the question of Jyoti, as simple, work on the complaints. That is more important. They are not worried about how much is the sugar. The sugar as such is not troubling them, but the symptoms are troubling. Numbers are separate from the symptoms. But clinically speaking, yes, it has a connection, but it is more of the symptom what we have to focus upon. So hope I answered.
Oh, well addressed, Revathi. That's where we speak again about the quality of life. Thank you. Too good.
Yeah, thanks, Jyoti, for the question. Yes, Sambodhi.
Yeah, first of all, congratulations, ma'am. Very nice case presentation. I just wanted to ask you one thing about this SIT you mentioned, right? The girl was eating 8, 9 idlis, then also she was feeling hungry, right? Like within 2, 3 hours, she's again feeling that fullness, feeling of fullness was not there. So you mentioned after your intervention, she was just satisfied with 4 idlis. So is it like you have included with the idlis, you have included more legumes and vegetables so that the girl was feeling full, or like how is it like after like your intervention, she started feeling full with 4 idlis? So,
Okay, see, there are multiple factors that went in. Okay, it is not just the combination of the diet alone. Definitely, yes, it played a role. But more than that, we have to work on her insulin sensitivity. See, she's taking insulin, but the insulin is not working inside. So the cells are still hungry. When the glucose doesn't enter the cell, obviously we get that signal. So the signal is taken to the brain and we feel hungry, right? So that has
yes.
to be worked
Hmm.
upon. So basically, what happened is one thing is yes, the combination of food. I included this legumes, eggs were included in our diet, groundnuts and this roasted Bengal gram were introduced in our diet. So that itself started giving a kind of a satiety. This is one.
Yes.
Second thing
Yes.
is that the very important part of what I see as a coach is that she's just a 13-year-old and she was like restricted inside four walls because of the COVID. The father was obviously that time the risk for COVID is very high for diabetic people, right? And especially this girl had a very uncontrolled diabetes.
Hmm.
So the father
Hmm.
was restricting her within the four walls. That was actually causing another stress to this girl.
Hmm.
So
Hmm.
the moment she started cycling, she loves cycling. She has a cycle, and when she started cycling, and she was allowed to play outside, not in the street, just outside the house. That itself was making her feel very better. So that also helped her in bringing down the need for more idlis. With a few idlis itself, she got that. She started experiencing that fullness.
That insulin sensitivity got better with the exercise, you're saying, right?
Everything matters, even the
Yeah.
emotions,
Yeah. Yeah.
right?
Yeah.
The
Yeah.
one
She
she
was.
loves was denied.
Yeah, as a teenager, she was feeling like a good playing with her friends and everything. Yeah,
Yes, yes. So
wonderful, ma'am.
everything, yeah.
Congratulations. Yeah, thank you.
Thank you. Any other questions? Right, if no questions, then I can end the session for today. Yeah. So Thank you so much, coaches. I will post this discussion in the YouTube and I'll share the link with you all. And I'll also share the link of the case presentation as such. So if anyone would like to watch it again, you can watch it. And thank you so much, Srishti, for this opportunity once again. Thank you so much for giving me an opportunity to relive that moment.
So when I'm getting the data sheet,
Yeah, definitely, yes. Yeah. No, because of this, now I start connecting with the father.
so
Yeah.
since you are still in the present moment, I expected this moment 24 hours.
Yes.
Do it, Revathi. We need
Yes,
it.
yes. Yeah,
Push it.
definitely, Jyoti. Yeah.
Okay. So
Sure,
thank you.
sure. Thank you. Thank you.
Thank you so much, ma'am, for such a
Yeah.
wonderful session. Thank
Yeah.
you.
Thank you. Bye-bye.